Hey, welcome back to the Explainer. Today, we're going to dive into a medication that, honestly, many of you might have in your medicine cabinet right this second. We are talking about famotidine.
Yeah, I thought so. That name probably rings a bell, right? It's one of those super common over-the-counter brand names that's become almost as famous as the heartburn it's supposed to treat. But what is it really?
Well, that brand name, Pepcid, is the drug we're looking at today, famotidine. Its official classification is an H2 receptor antagonist. Now, I know that sounds a little technical, but all it really means is that its main job is to cut down on the amount of acid your stomach is making. So let's break down exactly how it pulls that off. So, our first section gets right to the heart of it. How does this little pill actually do its thing? The mechanism is actually kind of brilliant in its simplicity. Okay, to get how this works, I want you to imagine the lining of your stomach is just covered in these tiny little on switches. These switches are what we call H2 receptors, and when they get flipped on, boom, they send a signal to your stomach to start pumping out acid. So what famotidine does is it basically comes in and acts like a cover for those switches, blocking them so they just can't be turned on. The results? Well, it doesn't shut down acid production completely, that wouldn't be good. It just turns the volume way, way down. And check this out. It gets to work fast. You can start feeling the effects in about half an hour, and it hits its peak power somewhere between 1 and 3 hours. And maybe the best part? A single dose can keep you feeling good for a solid 10 to 12 hours. That's a pretty long-lasting relief from just one little tablet. Okay, now let's move on to our next section. And this is where things get really interesting, because famotidine has what I like to call a surprising double duty. It's not just for heartburn. So on the left, you see its day job, treating gastrointestinal or GI conditions, things like ulcers where the stomach is just making way too much acid. But over on the right, we see its other, kind of secret life, helping out with severe allergic reactions. You see, while your typical allergy meds block H1 receptors, famotidine blocks H2 receptors, and it turns out both are involved in a big allergic response. It's this fascinating second job for a stomach drug.
Now, with any medication, it is absolutely vital that we understand the safety profile. So let's take a clear-eyed look at what you need to watch out for when it comes to famotidine.
You know, like any medicine, it can have side effects. The most common ones you'll see are things like dizziness, maybe a headache, and some GI stuff like constipation or diarrhea. For most people, these are pretty mild, but it's always good to be aware of what could happen.
Now, there is one very specific warning about drug interactions that you need to know about. Famotidine should be used with caution if you're taking other drugs that are known to prolong something called the QT interval. This is a really specific part of your heart's electrical cycle that you can see on an EKG. Messing with it could potentially lead to an irregular heartbeat, and that's exactly why it is so important to tell your doctor or pharmacist about all the medications you're taking.
So, what's the number one absolute deal-breaker reason not to take this drug? It's simple: a known allergy. If you've ever had an allergic reaction to famotidine or a similar medication before, it's a no-go. It's just not for you.
There's also one other special consideration worth mentioning. For treating acid reflux, or GERD, during pregnancy, our source material notes that while famotidine has been studied, other medications might actually be preferred as the first thing to try. This is, of course, a super important conversation to have with a healthcare provider.
All right, let's wrap up with our final section and get practical: dosage and forms. This is all about how the medication is actually supplied and, how it's taken. Famotidine is available in a few different ways. In a hospital, for example, it can be given as an IV or intravenous solution. But for most of us using it at home, you're going to be familiar with the oral tablets. They usually come in 10, 20, and 40 milligram strengths. And how much should someone take? Well, this simple table here lays out the standard dosages pretty clearly. For adults, a common dose is 20 milligrams every 12 hours, either by IV or just as a pill. Now for kids, the dose is calculated really carefully based on their weight to make sure it's both safe and effective for them. So, after all that, what's the big picture here? What's the main takeaway? Famotidine is a fast-acting, long-lasting acid reducer that works by basically flipping the off switches in the stomach. And it has this cool secret identity as a surprising ally when fighting allergic reactions. And that brings us to the end of our explainer. It really makes you think, doesn't it, about all the hidden complexities in these everyday things we use. So I'll just leave you with this question to chew on. What other common over-the-counter medications out there might be hiding a surprising second life? Thanks for joining us.